Welcome to Aesthetics Unfiltered, honest conversations about regenerative, doctor-led aesthetics. This series is designed to share relevant, evidence-based information so that you can make informed decisions about your skin and treatment options. Today we're talking about menopause.
How terrific.
How to condense such a massive topic into 10 to 15 minutes.
Yes, it's
Not
a
easy.
lot to cover.
Well, you've got lived experience, Kerry, even though you are only 51 years old. Yeah. 51 forever.
Yeah, that 51 forever is probably the grandchildren are now starting to twig onto that. So I might have to just up it a little bit. But yes, you are right. It is a very challenging time in women's lives. And as you know, it can be at any age.
It can, yeah.
And it's very hard.
Yeah, I think with growing awareness, thank God, these days of perimenopause and symptoms that women have been putting up with for so long, now we're recognising that it is perimenopause, it's that decline in oestrogen that we're getting. People are noticing changes in their skin a lot earlier, which pros and cons.
Well, it's good to be educated because I can tell you now, when I started going through that, it wasn't talked about.
No.
And we had no information, and it was like, oh, well, that's just what happens. And you know,
even for me going through GP training, it just wasn't well taught, in my opinion.
Yes.
I really, as a female GP, had to go off and do my own reading and look up all of the resources to make sure I was offering the right advice. And there was certainly, I think we're far better at managing it now.
Yes, I would say that now looking at it, I think, oh my God, that is something that I went through and I had no idea. And wow, there could have been a better way to handle it.
Yeah, absolutely.
So, but we're talking about skin.
Skin, yes. So lots of changes in our skin through menopause and perimenopause. It's all because of declining estrogen. So our ovaries are going into retirement and they're not pumping out as much estrogen as they used to be before they completely stop entirely. So fun. So estrogen, we have estrogen receptors all throughout our skin. And estrogen is really important in regulating our fibroblasts, the cells that make collagen and elastin, as well as estrogen contributing to our skin barrier. So as we get decrease in estrogen, our skin becomes more sensitive. It can become more dehydrated. You can get breakouts of acne. But also because we're not making or maintaining as much collagen and elastin, our skin becomes thinner.
Yes.
And it looks saggier. And this can all feel like it happens. Yeah, great. Everyone walks into the clinic, grabs the back of their face and goes, I just want you to do this.
I just need this.
Yeah. I think it can really sneak up on people, on women. And it feels like it all happens at once sometimes, even though it's been subtle changes over years, because not only is our skin aging and photo-aging and we're getting lines and wrinkles, but then we get this sudden decline in estrogen and it all compounds and it all just feels like it happens at once sometimes.
And it's hard too because we do see patients come in that are dealing with that. But it's the emotion that goes with it as well, which isn't really talked about. It's you've got that physical look, but it's also that emotional thing of how you're feeling and these feelings that you can't control sometimes, and it just compounds. So when they come in and they just sit there and they cry and they go, my skin. Yeah. It's like,
the skin is just the surface of what's going on.
But the good news is that we have got lots of things in the clinic, especially now because we have the online shop with what we offer. Yeah. So we have absolutely expanded what we can use.
So many things. And skincare in menopause, often people will start adding more active ingredients or thinking, I need to change something because this cream I've been using for years is now no longer suiting me and I'm getting red and I'm sensitive. So people add things, but actually what they need to do is simplify their skincare.
You're right, because they overload it. Yeah. And your skin just goes into a whole thing of not being able to cope. So and quite often we're cutting out a couple of things and replacing them just with one or two key things, keeping it really simple so that their skin's looking great still. But yeah, really important. I know it's very frustrating when you get the acne at an older age, and I never suffered with acne as a teenager. So when I got it when I was older, I was like, this isn't quite right.
I can only imagine.
And I don't like it. I don't like it because you know what I'm like with my skin.
Yes.
So it is easy to manage if you've got the right place to come to, and you've got the right
You just essentially you need to have a think about what's not working for you and have a consultation with someone who has a bit of an idea.
And probably don't try too many things and don't change too many things at once, because when you have got that sensitivity, if you're changing up too many things at once, we don't actually know what's causing it.
Exactly.
And it is very different for every person.
Yeah,
I think that's the main thing,
is
is just because your girlfriend says that it's great or your neighbour across the road, doesn't mean that that is going to be great for your skin.
Very true.
Don't go and buy just anything on somebody's say-so.
Yeah. Has to be individualised.
Oh, absolutely. Yeah, really.
And there are so many products these days. So obviously you need to continue your sunscreen, SPF 50 plus, broad spectrum every day. But sometimes you do need to change which sunscreen you're using in menopause. Your skin changes, it's different. You're going to have different needs. So sunscreen's a big one to continue. What else do we need? Something hydrating.
So moisturisers. Now, all depending on how sensitive they are, whether they have actually got rosacea, early stage rosacea, all of those things come into play, and even the sunscreen that we would recommend would be different for each person. Now, we probably have about 4 different sunscreens that are TGA approved.
That's important.
That is the most important thing. You need to still wear your sunglasses, wear a hat. They're the biggest anti-agers.
And so easy and cheap.
Yes, yes. But that is honestly the biggest thing that you can do for anti-aging.
Yeah, sunscreen.
Those things.
Yeah.
But by using just some really good calming products that just soothe the skin, can keep that barrier in that might be impaired or is starting to become impaired. And look, they will be sensitive, and they could be sensitive in their emotions as well, which is compounded.
Exactly, that can often make rosacea worse.
Yes.
100%.
Yeah. So you need to be aware of all of that.
And when you say barrier support and hydration, niacinamide, vitamin B.
Absolutely. Niacinamide. If I could bathe in it, I would.
Good.
If somebody's got an idea on how you can bring it in some sort of bath sort of thing, that'd be great. There are some really good treatments that you can do that way to hydrate. It's all about hydrating and just trying to keep everything nicely balanced.
Exactly. Hydrating things like ceramides and hyaluronic acids, barrier support with vitamin B, niacinamide, sunscreen every day. And then, as you said, there's the whole, not only is there skincare, but there's the whole non-surgical realm of medical skin treatments. I'm trying not to get in trouble here.
Yes.
But there are lots of things we can do to boost your collagen and elastin. So our skin is firmer as we get older. Yes, we can talk about devices. Yes, so things like the Ultherapy Prime device, which is ultrasound-based tissue tightening, stimulates the growth of new fibroblasts, new collagen and elastin, and tightens up the existing fibres that are there. That's really good.
And there is some fabulous clinical papers on that.
Yeah, there's no doubt
back
that it
that
works.
Up.
Yeah, it's science.
There is enough papers with science behind them. And there's, some other stuff that we can do to, have the skin, it's sort of like the icing on the cake. That's how I like to put it, is for that skin quality. And that you can do on skin. Even for myself that has rosacea and sensitive skin, they certainly work very well for me.
Yeah, absolutely. We just be careful and we keep it in mind that you have rosacea.
You've just got to have that knowledge, I think, of what you can and can't do.
Yeah.
And I think it comes with, going to conferences, always studying, learning about it, and making sure that you're in qualified hands.
Yeah. Menopause is a huge topic. I can talk about it for a while. I think finally, to wrap it up, I've just had a thought because I saw another patient this morning who's been doing this. Please, everyone, public service announcement, please stop putting estrogen cream designed for your vagina or your skin, like your arm skin, on your face.
Oh,
No, no, no.
okay.
It does not work. It doesn't help. In fact, it can make your skin on your face more sensitive, impair your barrier more, and then you're in a world of trouble. Just don't do it.
Don't even know how to address that one.
Yeah, no,
so
fair
I'm
enough.
just,
Yeah, sorry,
I'm just not. I'm
I
not
really
going
threw that
around
one
with
at
that
you.
one. Yeah, wow. Okay. I actually, right. Yeah.
Yeah,
Okay.
doesn't help. Good.
Right.
Yeah.
Well, that's
right.
one way to wrap things up.
It is. Every face is different, and that's why personalised, evidence-based planning matters. If you have specific concerns or want tailored advice, consider booking with your local doctor-led aesthetic clinic as the first step before committing to any treatment.